And it's my understanding you guys have access to the PowerPoint presentation, a printed copy. The one that I'm going to go over today is slightly abbreviated from the original copy, but certainly we can talk about, if there's any questions about the other slides that we don't cover, we can talk about those. But I tried to just, take out some of the extra info, make sure we cover all of the basic important information. So if you are looking at the printed copy, you'll see that there's a few extra. Okay, first I wanted just to do a brief overview on the disease states that these medications are used to treat. Depression, there's many different types of depression, but mostly we associate depression with feelings of sadness, hopelessness, guilt, loss of interest, changes in sleep patterns, changes in appetite, and lack of energy. Most of these conditions can be caused by several factors, a combination of genetic factors, biological, like hormones, environmental life events, and also imbalance of neurotransmitters. And that's really what I'm going to focus on today, just because that has to do with the mechanism of action of the medications we'll be discussing. So depression has been associated with the imbalance of the neurotransmitters serotonin and norepinephrine. Schizophrenia, that has three sets of symptoms, usually positive symptoms, which are hallucinations, delusions, movement disorders. Negative symptoms, which have to do with emotions and behaviors, so like a flat affect or loss of pleasure, and cognitive symptoms. Lack of focus, impaired judgment, impaired executive functioning. So some of the people who suffer from schizophrenia have a hard time understanding information and then being unable to make a decision based on that information. And we think that schizophrenia has to do with the imbalance of dopamine. Bipolar disorder, usually bipolar disorder presents as an alteration of manic and depressive episodes. Manic manifests as fast speech, racing thoughts, restlessness, impulsive behavior, high-risk behavior, and insomnia. And then, of course, the depressive episodes like we already discussed. We think that serotonin, norepinephrine, dopamine, and GABA are the neurotransmitters involved here. And GABA stands for gamma-aminobutyric acid. We always just call it GABA, though. ADHD, or attention deficit hyperactivity disorder. That's where we have hyperactivity, difficulty staying focused, difficulty paying attention, and controlling behavior. And norepinephrine and dopamine are the neurotransmitters involved there. Anxiety disorders, there are many different types of anxiety disorders. General symptoms are fear, uncertainty, and dread. We have panic disorders, which mostly we refer to as panic attacks. So that's when someone would have their heart racing, sweating, weakness. They might feel faint, dizzy, nauseated. Some people actually have chest pain, muscle tension. Obsessive-compulsive disorder, that's where a person would have upsetting thoughts, and they use rituals to try to control the anxiety about these thoughts. An example of that is like hand washing in response to the fear of germs. PTSD, or post-traumatic stress disorder, that usually develops after a terrifying event. Patients with this can often just relive the trauma through flashbacks. Social anxiety disorder, people can become extremely anxious in social situations. And then general anxiety disorder, that's just a general exaggerated worry and tension about everyday living and things that one encounters on a daily basis. So the neurotransmitters involved here are GABA, serotonin, and dopamine, among others. So those are the ones we'll focus on. Insomnia, difficulty sleeping. So a person may have difficulty falling asleep or staying asleep. The neurotransmitters involve GABA, serotonin, norepinephrine, and dopamine. And you can see that these neurotransmitters that we talk about are in various conditions. It's not specific to just one type of disorder.